My name is Arrillaga. I'm an LCDC, that's a licensed chemical dependency counselor with In Mind Out in San Marcos, Texas. And one of the big things that a lot of people question when they come in is whether or not addiction is really a disease, and if so, what kind of care do you need for it? A lot of people think of addiction as being a moral failing, and that's understandable. A lot of times that's what it looks like from the outside. But the inside experience of people with addiction often requires a lot more compassion. And that's how we understand it as a disease. It really is a brain condition, and it requires professional care in most cases. 2 out of 3 people have no chance of recovering on their own. However, with help, there are great outcomes for people. So the next thing a lot of people ask is then, what kind of care do I need? The first thing most people think of is residential or inpatient treatment, and that's usually appropriate for people that are really spiraling out of control. They're having major life issues around their addiction. Could be things like losing their job, losing their family, losing their legal status, things like that, or maybe some of those things are already gone, and often those people seek inpatient treatment. Instead of that, or maybe after that, some people go for outpatient treatment, and that would be meeting several times a week with a group and doing treatment that way. So they might do residential and then outpatient, or they might just go straight to outpatient. But a lot of times people don't really know what it is they need, and so sometimes they will come in and seek individual care, and that's the kind of thing that we do at In Mind Out. So that would be coming in, sitting down one-on-one with a counselor, getting to see what the individualized problem is and seeing what kind of care would be appropriate. And some people settle into that. Maybe the problems aren't as severe, or they want to give a shot at handling it from, living at home, working a regular job, all those sorts of things. And so we would sit down to do individual one-on-one care. That also works really well for people that might be very nervous about sharing in a group, or really aren't sure what that would be like if there's some things they're not sure about talking, or they want to be able to sit down if something comes up, unlike a group setting, being able to really burrow into that and maybe do some individualized healing. And that's what we do here. So all of it is done from the compassionate understanding that this really is not about bad people trying to be good, but it's about sick people trying to be well, and understanding that they can live a life that is not just great, not just okay, I can get by without my addiction, but where they can really thrive. And that's one of my passions, is helping people thrive, helping families understand, doing family therapy around addiction, anything that can help the healing around this pernicious disease in our society. And so that's why we do what we do. Thanks.